Hello, my name is Shelby Belcher, and I am here to represent the Better Healthcare Agency of California. Before I begin, let me quickly tell you a story about a girl with third-degree burns on her face, neck, and hands. The pain was immeasurable, and the fear was immense. She lay in the ICU listening to the nurses and doctors talk about the risk of infection and what it meant for her life. The doctors and nurses all told her, "You've burned your neck to the point where your trachea is exposed. If it gets infected, it is likely that the infection will spread to your lungs, and at this point, if the infection is not stopped, the functionality of your lungs would be compromised, which could result in suffocation and death. We'll keep you in the ICU until the risk of infection has passed." This is definitely not something any patient wants to hear. This burn victim was me, 4 years ago. And although this was not a fun experience to go through, it opened my eyes to the terrifying world of infection that can spread so easily throughout hospitals. I was very blessed to receive the kind of care that I did at the University of California, San Diego Medical Center. After 2 months in the burn center, I was released without ever developing any infections. However, not all patients are this lucky. Healthcare-associated infections, or HAI, are infections that patients develop while receiving medical care. It seems a little backwards for patients to be getting sicker while under the care of physicians, right? At any given time, about 1 in 25 patients develop an infection while receiving healthcare treatment in U.S. hospitals. This issue can affect anyone, young or old, burn unit or cancer ward, rich or poor. Infections do not discriminate. There are thousands of people in American hospitals on a daily basis. 1 in 25 developing infections during their time under our care is a deplorable and expensive statistic. HAI in hospitals alone can result in up to $33 billion of excessive medical costs every year. $33 billion spent on care that could have been prevented with a $3 bottle of hand sanitizer, a 50-cent face mask, a $2 clean catheter, or a line replacement. Preventing infections costs a fraction of what it costs to treat them, but for some reason, this problem still exists. The state of California has made strides towards improving their statistics on HAI. However, these improvements have not eliminated or even come close to eliminating a primarily preventable problem. On September 28th of 2006, Senate Bill number 739 was passed. This act was added to Article 3.5 to Chapter 2 of Division 2 of the Health and Safety Code relating to healthcare facilities. This bill would establish the Hospital Infection Disease Control Program, which would require the department and general acute care hospitals to implement various measures relating to disease surveillance and the prevention of healthcare-associated infections. One thing this bill implemented was a reporting system that required each general acute care hospital to prepare a written report that examines the hospital's existing resources and evaluates the quality and effectiveness of the hospital's infection surveillance and prevention program once every 3 years. The bill also required general acute care hospitals to take other preventative steps, such as improving safety guidelines with central venous catheters and making any reports and statistics collected in regards to these measures public within a timely manner. Senate Bill number 739 was a great start. However, it has not solved the problem and changes need to be made. The new HAI policy, number 740, Chapter 527, would initiate much-needed expansions on this slightly small-minded bill. The biggest change would be to include every medical facility in the state of California in the HAI policy. The current piece of legislation is inclusive only to general acute care hospitals. However, because patients with HAIs, including HAIs caused by antibiotic-resistant organisms, often move between various types of healthcare facilities, prevention efforts must be expanded across the continuum of care. The challenges presented by antibiotic-resistant organisms are best addressed through coordinated action among healthcare facilities in a given region, which in this case includes the entire state of California. Recent studies suggest that implementing already existing prevention practices can lead to a 70% reduction in certain HAIs. Likewise, recent modeling data suggests that substantial reduction in resistant bacteria like MRSA can be achieved through coordinated activities between all healthcare facilities in a given area. It's time for the California healthcare organizations to work together as a team. With this bill, our goal is to amplify the current prevention practices and make the new standard the best practice preventative measures that could potentially increase the 70% reduction average to as much as 90 or even 95% depending on the case, with the ultimate goal being 100% or very near 100% reduction. The new bill will include all medical facilities, regardless of size, demographic, location, or profitability. Any office that sees patients for medical treatment or procedures will be required to update their standards to include Senate Bill number 740. This means all ambulatory surgical centers, all long-term care facilities, dialysis centers, outpatient care offices, everyone in contact with patients will be held to a higher disease prevention standards. In reality, it doesn't make sense to do it any other way. Why would one facility's patients have the right to receive higher quality infection prevention care while another facility's patients do not? Regardless of where a patient is seen, everyone has the right to feel safe and well taken care of in the medical facility of their choosing. One of our 4 bioethical principles is justice, meaning every patient is treated equally and equitably. This is inclusive of their facility's HAI prevention standards. Another change to be enacted to the current policy will be the reporting system. Written reports will now be required of all medical facilities, and they will be required annually. Beginning January of 2019, every medical facility will be required to submit an annual report to the department on its implementation of infection surveillance and infection prevention process measures that have been recommended by the Centers for Disease Control and Prevention, the CDC, Healthcare Infection Control Practices Advisory Committee. This will allow officials to monitor these changes and make necessary adjustments as needed. The purpose of the increased reports is to allow the department to understand and analyze the causes of death related to the infections. The more we know, the more we can prevent, and our hope is to build a healthcare system where death by preventable infections is rare, much more rare than 1 in 25. Of course, changes this big require training and additional employees, both of which require money. I am sure the question on everybody's mind currently is, will this be financially beneficial? Now imagine for me, the girl with third-degree burns. Let's envision an alternate ending. Instead of her burns healing and the treatment going as planned, the girl develops an infection. The infection spreads to her lungs and the girl dies. Now the girl's family sues the hospital for millions. The trial takes months and the hospital's solid reputation is dragged through the mud. What was once the most highly sought after burn unit is now that place where the girl died from preventable infections. The hospital not only loses millions to the girl's family, but they also lose millions, potentially billions, from losing the support of the community and scaring away patients. Not to mention, they lost a life. A young, otherwise healthy woman that potentially could have survived her injuries had she gone to another hospital. That's not what we want. Also, keep in mind that the California Constitution requires the state to reimburse local agencies for certain costs mandated by the state. Statutory provisions establish procedures for making that reimbursement. With regard to any other mandates, this bill would provide that if the Commission on State Mandates determines that the bill contains costs so mandated by the state, reimbursement for those costs will be made pursuant to the stated statutory provisions. In the end, the financial benefit of using these improved and expanded prevention practices is estimated to be $25 to $31.5 billion in medical cost savings. We also need to consider that while there is considerable variability in the costs of healthcare-associated infections, even the lowest cost estimates of $5.7 to $6.8 billion annually are substantial when compared to the cost of inpatient stays for other medical conditions. According to the Agency for Healthcare Research and Quality, the three principal diagnoses with the highest annual collective inpatient hospital costs in 2006 include coronary artery disease at $17.5 billion, heart attack at $11.8 billion, and congestive heart failure at $11.2 billion. The direct medical cost of preventable HAIs are comparable to the cost of stroke at $6.7 billion, diabetes at $4.5 billion, and chronic obstructive lung disease at $4.2 billion. Even if the effectiveness of HAI prevention is low, which obviously is not the ultimate goal, we can still save money by reducing the rate of these infections. We as healthcare professionals and patient advocates can't afford not to enact this policy. Lives and the reputations of hospitals and medical organizations are at stake. What will the community think if they see that we chose not to improve our HAI standards? We will be telling an entire state of patients, as well as the United States, that the absolute best, most advanced, most precise, and safest healthcare cannot be found in California because we didn't feel as though it was important enough. We'd rather continue contributing to the $33 billion that is spent on HAI cases every year. Regardless of your position in healthcare, everyone can benefit from higher safety policies and more thorough reporting. Beneficence means always working for the benefit of the patient. Non-maleficence means to do no harm, which coincidentally includes preventing infections and deaths. These are two of the 4 bioethical principles that we in the healthcare industry pride ourselves on, and we cannot continue living up to our principles if we do not keep our standards high and our policies updated. If this policy is passed, the state of California will be at the forefront of innovation and strategical patient safety management. Patients put their lives in the hands of medical staff every day. There is no other option but to increase our HAI standards and save the lives of our patients. You should never have to walk into a medical facility and wonder if your health will become worse because of the facility you have chosen to seek care at. Infections are not an option. They are not tolerable, and preventable deaths are not simply a statistic. Our job as the Better Healthcare Agency of California is to ensure the patients in this state receive the best, most attentive care. We can prevent deaths by HAI, and with this bill, we will be one step closer to no deaths by preventable infections in California. Thank you.